So why is dentistry better now? Why is digitization and using an intraoral scanner so much better than what it used to be? And this is a video I've played in one of the earlier webinars, and I can't help myself. It's a video that I've taken from social media on one of these meme accounts on social media. And it really just sums it up. A lot of us watching this will be able to relate, especially I can relate in terms of my first ever impression on a patient at dental school. And you do have to think, how did we used to do this so often? And I know we still do, but how did our patients put up with this? It's especially these days, a lot of us spending a lot of time and effort and an investment to learn and upskill and become better dentists and have better communication. And then at the end of the appointment, you have to do an impression. And frankly, it's not a nice experience really for anyone. The dentists don't really like it. I know personally as a dentist, I didn't like doing impressions. And these days, there's just a better way. And I'm not going to bore you with this because I'm sure you've heard it before. But scanning, no doubt in my mind, and this is literature proven. There's so much literature out there now on scanners, on scanning, on accuracy, on trueness. And the literature is clear. Scanners are as accurate, if not more accurate, than impression material. And the reason for that is we always assume, well, we have errors with scanning, but oftentimes, you can have errors with impression as well, drags, air bubbles, all these sort of things. And the other thing is that what about all the steps involved to getting an impression to the lab? Oftentimes, or even to have something, a workable model for the lab, this impression has to be poured up. It has to be poured up in stone. The stone has to be mixed properly. Any temperature changes, any air bubbles in that. There's so many factors. And the reality is digital dentistry will save you a lot of money. It will save you money on impression costs, Improgum and PVS and all these things cost a lot of money. And they're not cheap to maintain. They expire as well. And this is a funny joke that I have with anyone who trains with us, is that I always tell them, I want your impression material in your clinic to expire. All of it. I want it all to expire when you get a scanner. I don't want you to get a scanner and just have it sitting there in the cupboard. I want you to be using this thing. The other thing is that we all know time is money. And this is why dentistry is so much better now with scanners. Everything is faster. Everything is more efficient. Everything is more comfortable for our patients. We can provide incredible service for our patients. How many of you have had a call from the lab or the couriers that they lost your impression or they lost lab work and all these sort of things? And it's just frustrating, especially if it's a big case. If you have taken an impression for a really big case, like 12 crowns, 14 crowns, and it is lost in the couriers, this is a nightmare. And this is really a nightmare. You have to bring the patient back, numb them up, take the temps off, retake it a hard impression, replace all the retraction cord, retemp, and simply this just doesn't happen anymore with scanners. It just never happens. And also redoing temporary restorations. And I would say this is for people that really get into digital dentistry and start to offer some form of same-day dentistry, either same-day crowns, same-day printables. As we all know, printing restorations is becoming more and more popular. And what about this? We forget that a lot of patients don't actually like having impressions taken, and they are genuinely impressed by technology like scanners, like milling machines, like printers. It is mind-blowing for them. And a lot of you don't realize that, or at least don't appreciate how much having up-to-date technology has an impact on your practice. In my own practice, I don't work in downtown in New Zealand or anything like that. I don't work in a very affluent area. On the contrary, my clinic is actually in one of the lowest SES areas or socioeconomic status areas, but we have carved out a name for ourselves as a really high-tech, highly high quality treatment center. And part of this is the technology that we've invested in, because people, I'm sure all of us can relate. When you go to a clinic that looks high tech, that looks clean, or anything, it doesn't even have to be a clinic, any shop, it helps you build trust, and you're impressed by the facilities. And scanners and digital dentistry as a whole allow you to achieve this. One of my patients, he put a review recently on our clinic, and it's quite funny. He mentioned that these people have more technology than NASA and things like that. So these people, these clients, when they come to your practice, they will tell their friends, they will tell their family, and it is free marketing for you.